Welcome to MACME. We're going to go over the changes that AHA has made from the 2015 guidelines to the 2020 guidelines. The 2020 AHA guidelines reaffirms the recommendation of use of early epinephrine, CPR feedback devices to maintain high-quality CPR, and the use of end-tidal capnography to monitor high-quality CPR during a cardiac arrest. The 2020 AHA guidelines does not recommend double sequential defibrillation. They do use IV as the preferred route for medication administration. This is not the case in Pinellas County EMS. The new guidelines recommend debriefing laypersons, EMS, hospital workers for the mental health and well-being of all that provided care for the patient. The 2015 guidelines stated that one breath should be administered every 6 seconds in a cardiac arrest with an advanced airway. In a respiratory arrest, it stated that one breath should be administered every 5 to 6 seconds. In the 2020 guidelines, we are administering one breath every 6 seconds for a respiratory arrest without an advanced airway or with an advanced airway, and in a cardiac arrest with an advanced airway in place. Bradycardia. Per AHA, in 2015, atropine was administered at 0.5 milligrams for bradycardia. In 2020, AHA changed to atropine 1 milligram for bradycardic patients. In Pinellas County, we follow our local protocols of 0.5 milligrams. Keep an eye out for protocol changes throughout the year. The 2015 guidelines state that when you synchronize cardiover a narrow regular complex tachycardia, you'll be shocking at 50 to 100 joules. For a narrow irregular complex tachycardia, it would be 120 to 200 joules, and a regular wide complex tachycardia, 100 joules. This has changed in 2020. In 2020, the AHA guidelines state follow device recommendations. And for a wide QRS irregular, defibrillate. The next change we're going to talk about is oxygen saturation in post-cardiac arrest care. In 2015, our goal oxygen saturation post-cardiac arrest was 94%. In 2020, this changed. Our goal oxygen saturation is to titrate oxygen to 92 to 98%. Next, let's talk about the chain of survival. In 2015, there were 5 links. In 2020, this changed to 6 links. We added recovery as the last link in the chain of survival. In 2015, IV and IO were equivalent. In 2020, per AHA, IV access is preferred over IO. In Pinellas County, IO is still preferred. In a cardiac arrest, it is recommended that epinephrine is given every 3 to 5 minutes or every 4 minutes. Amiodarone and lidocaine are now equal equivalents. The maternal cardiac arrest algorithm has been added. Ventricular device information and algorithm has been added, and prognostic diagram and information recommended waveform capnography with BVM has also been added to the 2020 AHA guidelines. The 2020 guidelines added a stroke algorithm for EMS destination. The treatment window for stroke patients has gone from 6 hours to 24 hours from the time of onset of symptoms. Also, EMS should consider bypassing the ED and going straight to CT. Finally, the stroke algorithm also added titrating oxygen to 94%. Please review the 2015 to 2020 changes in the AHA guidelines. You will see these changes reflected in your BLS and ACLS classes. There haven't been any changes made to our local protocols. You might see some of these changes reflected in our protocol changes in the future.